Welcome to the O Ozempic and Semaglutide podcast. Get ready to hear from best-selling healthcare author Dr. Josh Luke as he facilitates a discussion on healthy weight loss and living healthy. And now, here's your host, Dr. Josh Luke.
Hey, thanks for joining the Ozempic and Semaglutide podcast. I'm Dr. Josh Luke, your host. Really excited to have our first pharmacist on to talk about the semaglutide injections. And fight on, he's a fellow USC Trojan. Many of you know I teach there. Welcome, Dr. John Probst, a USC trained pharmacist, to the show.
Hey, Josh, thank you for having me. Looking forward to chatting with you about this really revolutionary medication and the weight loss revolution. So
yeah, it's exciting stuff. And the goal on our show is just to answer those normal questions your friends and mine have about, hey, what's this new weight loss shot? I've heard about Ozempic, semaglutide. What is it? What are they? And today I just want to tackle for the first time in your words, a pharmacist's words, because I'm not a doctor, just a PhD. But in your words, I want to get into what these are and how they work and how they came about. But before we do that, let me just share with the audience. Dr. Probst is a clinical pharmacist at Adventist Health, a very reputable healthcare organization in the Western region. He also works for the Regional Center, which is an awesome program that helps a lot of developmentally disabled patients throughout Southern California. Tough can be a tough job sometimes, I know, John, but thanks for your service. But tell us a little bit about what a GLP-1 agonist is, which many are referring to as the new miracle drug.
yeah, absolutely. Simply put, GLP is a glucagon-like peptide, and it's an agonist. So basically, it tricks the body into thinking that the glucagon-like peptide is present. And essentially for type 2 diabetes patients and people who are obese, it tells the body that you're in the fed state. And when you're in the fed state, you're not hungry, obviously. And the other main effect it has as well is a slowing of stomach emptying. We call that gastroparesis, is actually a kind of the full manifestation of that. But food basically travels through your system slower. You get fuller faster. I think some folks who have been on the meds for a while have just really seen a drastic dip in their appetite and the amount of food they eat. So all that together leads to pretty successful and drastic weight loss.
So, this class of medication has a lot of effects, right? It has appetite suppression, increased insulin production, decreased glucose production, increased glucose uptake in muscle cells. And I think you summarized it another way, which is it tricks the body into thinking that this GLP-1 is present. So to the layman, what is, give it to me in layman's terms other than tricking the body. What is it? Because I say on almost every show, guys, if you're going to pay for these injections, they're not burning fat. They're just telling you you're not hungry. So be on a meal plan. So tell us just a little bit more about what the drugs are doing.
Well, to put it simply, it's like flipping a switch. And I always come back to the fed state. So all those things you mentioned as far as the effects of the medication, it basically flips a switch, and your brain and your body, and again, those two are always interlinked, because your stomach talks to your brain, your liver talks to your brain, all the endocrine communication, endocrine being hormone communication, it's always trying to seek equilibrium. So if we can flip the switch that says we are no longer hungry, we don't need calories, we are in a state that allows us to not pursue calories, or at least desire them, great. I mean, that's the holy grail of weight loss. So ultimately, from a layman's perspective, you can expect a short list of outcomes, and that essentially is eating less, gaining, or not gaining weight at all, because you're in that fed state. And the beauty of that is that you don't have the suffering of hunger and the requirement of really, restricting your calories in order to get those outcomes that you want. So Yeah, if Joe Schmo walked up to me on the street and says, "What does this drug do?" I said, "Makes you less hungry and it helps you essentially lose weight, drop pounds." And that's why it's such a big deal. Everybody pretty much wants that outcome.
And my doctor, before I started, said, "Hey, the people I talk to that are on it just tell me they stare at their dinner," and that's actually what has happened most with me. I feel the effects most at night, where I might think I'm hungry, but I sit down, I order dinner, and by the fourth or fifth bite, I'm just like, I'm done. And I attribute that to maybe because you're eating for those 12 prior hours, whereas when you wake up in the morning, you haven't been consuming. But I'm still not hungry, hardly ever. And so interestingly, John, similar to when Viagra was created on accident for what we know it for, right? This Ozempic being the first, this medication, which is generically semaglutide, but Ozempic was the first brand name, was really developed to help patients with type 2 diabetes. So even though part of that development was to lose weight, it was also to reduce blood sugar levels and lower the risk of cardiovascular death. So tell us about that. Why was this such a surprise if in fact they set out to create something that they knew they wanted to help lose weight? But the research and studies have all said, wow, it's great at this. So why was it such a surprise?
Yeah, I mean, we've been here before. I think Saxenda was a precursor. Ally and Xenical, those were weight loss meds with kind of the byproduct of maybe helping with blood sugar management. But ultimately, just because you're managing blood sugar doesn't mean you necessarily get the weight loss payoff. I mean, there's oral meds that help with blood sugar management, but you don't see the benefit of weight loss. Typically, when you look at a pre-diabetic or diabetic patient, they have to implement those therapeutic lifestyle changes in order to get the weight loss as well. Now, the weight loss will help them manage their blood sugar, but most of the interventions prior to these GLP-1 agonists were just managing blood sugar, which is important, obviously.
Yeah,
But when you see the byproduct of managing your blood sugar and getting your H1C more under control, but when you see the byproduct of the weight loss as well, that's a win-win. I mean, you're having your cake and eating it too. So that's like I said, the holy grail when it comes to these kind of meds. You're getting positive disease management outcomes, but also that great outcome of weight loss, which, living in California, especially Southern California, we all like to be trim and fit. So
yeah, and as we discussed about it, kind of similar to Viagra being kind of developed by accident for what it's being used for now. This is also part of the reason we're gonna have a whole other episode on will my insurance cover it, and there's actually been a lot of activity on the insurance front on these injections in the last few weeks, but that's part of the reason it's not normally covered and hasn't been covered is because Ozempic, the original, was approved and created not as a weight loss drug, right, but a diabetic drug. So since
correct.
Novo Nordisk created Ozempic, and they have another one called Wegovy that I believe Wegovy is approved for weight loss because it was kind of introduced really quickly. Oh, let's do one for weight loss. And then Eli Lilly came out with Manjaro. There's another one that Lilly's coming out with next year. I think it's pronounced retatrutide. But here they come, and they're revolutionary. And when we talked off the air, you used a term that I thought was pretty cool. It's a weight loss revolution. I've seen in print. It's a numerical drug. But here's what everybody wants to know. And again, we're going to do a whole other episode on it, on insurance and how you get it covered. I actually am interviewing somebody who's an insurance and benefits expert who will be joining the show with us in a couple of days. But so is it safe? I mean, John, is it safe? Is this something that you would do, that you've considered doing, that a friend or a loved one or a spouse said, hey, is this safe? Should I do it? How would you react?
Yeah, no, it's a great question. The holy triad of any med is safe, effective, and cost efficient. Cost afford. Is it affordable? Sadly, these drugs aren't very affordable, but we'll let your insurance person talk about that. Effective, hands down. They are amazingly effective. Safe, and that's the one of the things I love having a public health background. I know it's USC UCLA week, so I fortunately have degrees from both schools. The public health degree from UCLA, but I usually don't share that with too many people. I'm Trojan man all the way. But yeah, the pharmacovigilance aspect of it. And pharmacovigilance is a fancy way of saying we're going to monitor the effects of this med in the population as more and more people use it. A good example of that recently, obviously, was your COVID shots. So it went from the lab to use, and now you're observing, what the impact and what the outcomes are. So to answer your question, is it safe? So far, the pharmacovigilance aspect of it is resoundingly yes. Have there been some situations where side effects have been, obviously intolerable or have had really bad outcomes? And of course, we hear about it. But the vast majority of people who have used these meds have had really good results, and they've been safe. I think back to meds like, Vioxx. Think back to that many years ago. A lot of folks love that drug, but because we had some studies that had some really bad outcomes associated with it, eventually we did away with Vioxx. Vioxx was a great drug. Was it great for everybody? No. But fortunately, so far with the GLP-1 agonists, the data so far suggests that not only is it effective, not only is it really successful at helping you drop weight and manage your blood sugar, but it's overall very safe as well.
There's a lot of studies coming out saying it's reducing your risk of stroke. I mean, it's more and more good news since I just started taping. So that's cool. And if you didn't hear, we had a third guest shortly, a few minutes ago, my dog. Sorry, we didn't picture her, but we heard her bark. And for that reason, you used a term I want to make sure I captured. You said anytime we're looking at a drug, there's three. What were the things you said? Safety, effect.
Oh yeah, I call it the holy triad. Does it work? Is it safe? And is it affordable?
Yeah.
If you can create drugs that are safe, effective, and affordable, watch out. Your revenue is going to jump off the charts. So
that's great. And I wanted to cover one thing before we wrap up here, because we try to keep these short. People ask me all the time, oh, I heard this, I heard that. And I always go research what they heard. And it's usually some crazy person on YouTube that's not a doctor or pharmacist saying, this happened to me, don't ever do it. But the one thing that there is some research that's come out on, it says, hey, we're researching this further, but most weight loss attempts or programs, you're usually burning about 20%, 20 to 24% muscle versus the rest body fat. And in this case, it's about 8 to 10% higher muscle, which would just lead me to believe I want to make sure I'm doing a little, not just cardio, but some weight training or something if I'm doing this, just to make sure I'm maintaining my muscle mass. Can you talk to us about that a little bit?
Sure. As you ramp up your dose with these GLP-1 agonists, the weight loss can be significant, and some of that weight loss can be muscle mass. So you definitely want to make sure you're having plenty of protein in your diet. And everyone, regardless of your age, health status, as far as I'm concerned, a limited amount of cardiovascular and resistance training is very important. You don't have to live it in the gym like some of these really fit people do. But yeah, in order to maintain your muscle mass, you do need calories, and you do need to use your muscles. So if you're burning X number of calories because you're restricting calories, that's not necessarily a good thing. So I think people do need to emphasize a healthy, well-rounded diet that has plenty of protein, because as people do push the dose, and I'm all for pushing the dose because you want the results that you're after. But yeah, you don't want to necessarily waste, and get that, I think that Ozempic face, and people have talked about that, where you just kind of start to waste away. It's not just fat coming off, it's muscle too. So, and if you've got oversight from a healthcare provider, that'll be something that they could observe and obviously guide you as far as managing those outcomes of using a medication like Ozempic and similar medications. So
cool. And just to wrap up, the question we like to wrap up each show with is, share with us just a favorite healthy meal or snack that you like to enjoy, so our listeners have some new ideas.
I've got a good list, but on a rainy day like today, I give me a good stew. Just put a stew on, get that crock pot out, put some meat of your choice. I like ham. I'm a ham guy, or maybe a little beef, and you got some low sodium broth, and some veggies, and let that thing just simmer all day. And I'm thinking about it right now, getting all hungry. So
you're making me crave short rib, man. So that's
veggies. So
well, Thanks for joining. This is great informational. We want to let our listeners know the different pharmacists and physicians and dietitians that we'll have on, your feelings on the safety and efficacy of the drugs and the injection. So thanks so much for joining us. This wraps up part 1. We're going to have you back shortly to talk about side effects, part 2 of our interview with Dr. John Probst, USC trained pharmacist. Thanks again for joining the show.
My pleasure, Josh.
You've been listening to the O Ozempic and semaglutide podcast. Dr. Josh Luke is a PhD, but not a medical doctor, and none of his comments or comments of his guests are intended to be medical advice. Make sure to like, follow, share, and subscribe to the podcast on Spotify, Apple Podcasts, YouTube, or wherever you listen to podcasts. Thanks so much for listening, and we'll be back soon with a new episode.